Tonight, while you are sleeping, something extraordinary is supposed to happen inside your body. A powerful built-in cleaning cycle is designed to sweep through your entire digestive tract, clearing out waste, rebalancing bacteria, and resetting your gut for the day ahead. It happens automatically, it costs nothing. And for most people over 60, it is barely working at all. I am Dr. James Harlow. I have spent more than 2 decades working with patients whose fatigue, brain fog, bloating, and joint pain all traced back to the same overlooked root cause. Not their heart, not their thyroid, their gut. And what I'm about to share with you in the next several minutes could genuinely change how you feel every single morning. Before we go any further, I want to ask you something honestly. When you wake up, do you feel rested and clear-headed, or do you feel heavy, sluggish, and foggy before the day has even started? Drop your answer in the comments right now. I read every single one, and your answer matters more than you think. Because that morning, heaviness is one of the most reliable signs I know that your gut is not completing its nightly cleanse the way it should. Here's something most people have never been told. Your intestines are not a passive tube. They are an active, living system roughly 25 to 30 feet long, lined with hundreds of millions of nerve cells, home to nearly 4 pounds of bacteria, and responsible for far more than digestion alone. Research published in Nature Reviews Gastroenterology and Hepatology confirms that your gut produces about 90% of the serotonin in your entire body. That is the chemical that shapes your mood, your sleep quality, and your sense of well-being. When your gut is backed up and inflamed, your brain pays the price directly. Now here is where things get critical for anyone over 60. After the age of 50, the muscular contractions that push waste through your colon naturally slow down. The beneficial bacteria that protect your gut lining begin to decline. Your digestive enzymes become less efficient. And the nerve network inside your intestinal wall, which scientists call the enteric nervous system, starts responding more sluggishly to signals. The result is a gut that moves too slowly, holds waste too long, and quietly generates low-grade inflammation that spreads throughout the body. A 2019 study published in the journal Cell Host and Microbe found that this age-related slowdown in gut motility is directly linked to higher levels of systemic inflammation, which in turn accelerates cognitive decline, weakens immune function, and increases the risk of cardiovascular disease. This is not a minor inconvenience. This is one of the central drivers of how we age. So what does this have to do with an overnight cleanse? Everything. Because the most powerful gut cleaning mechanism your body has does not require a pill, a powder, or an expensive supplement. It is already built into you. Scientists call it the Migrating Motor Complex, and understanding it will change the way you eat dinner for the rest of your life. Here's how it works. When your stomach is completely empty and you are not actively digesting food, your gut initiates a sweeping wave of muscular contractions that moves from your stomach all the way down through your small intestine and into your colon. This wave cycles roughly every 90 minutes. It pushes residual food particles, dead bacteria, and cellular debris down and out of your system. Think of it as the overnight janitor that comes through when the building is empty and scrubs the floors. But there is one condition that is absolutely non-negotiable. The janitor cannot work if anyone is still inside the building. The moment you eat anything, even something small, even a handful of crackers or a few bites of fruit, the migrating motor complex stops completely. Your body redirects all its resources toward digestion, and the cleaning cycle does not resume until your stomach empties again, which takes another 3 to 4 hours at minimum. This is the single most important fact I want you to carry out of this video. If you eat dinner at 8 o'clock, your stomach does not empty until around midnight or 1 in the morning. If you wake up at 6, your gut has had maybe 5 hours of true cleaning time. But if you also snacked at 10 or had a small dessert after the main meal, you may have gotten almost none. That morning heaviness you feel is not just tiredness. It is your gut telling you it never got to finish the job. Now I want to talk about something that tens of millions of people do every week in the belief that they are helping their gut, when in reality they are quietly making the problem worse. I am talking about laxatives and commercial colon cleanse products. I see this in my practice constantly. A patient comes in feeling bloated and sluggish. They have been taking an over-the-counter laxative a few times a week for months, and they cannot understand why they feel worse than when they started. Here is the physiology. Stimulant laxatives, the kind that contain senna, bisacodyl, or similar compounds, work by chemically irritating the lining of your colon, forcing it to contract rapidly and expel its contents. Your colon does not do this because it has been helped. It does it because it has been startled. Over time, repeated chemical stimulation desensitizes the nerve endings inside your colon wall. The gut becomes dependent on the external signal and loses confidence in its own ability to move on its own. A review published in the American Journal of Gastroenterology documented that long-term stimulant laxative use causes measurable damage to the enteric nervous system, leading to a condition called cathartic colon, where the gut becomes progressively less capable of functioning without pharmaceutical intervention. You start with one tablet. 6 months later, 2 tablets barely work. That is not cleansing. That is dependency. And I want to be equally clear about aggressive bowel irrigation methods that some people turn to out of desperation. Stripping the colon repeatedly of its contents also strips away the protective mucus lining that coats your intestinal walls. That mucus is not waste. It is your first line of defense against harmful bacteria, inflammatory compounds, and the toxins that your gut works constantly to keep out of your bloodstream. Removing it regularly does not make you cleaner. It leaves you more vulnerable. So what does actually work? The answer is built around 3 things: timing, targeted foods, and body position. And when you combine all 3 correctly, the results people experience within the first 24 to 48 hours genuinely astonish them. Let's start with timing because this is where the foundation is laid. The single most effective change you can make tonight before you touch a single food or supplement is to move your last meal of the day earlier. The research on this is remarkably consistent. A study from the Salk Institute found that restricting eating to an earlier window, ideally finishing by 6 or 7 in the evening, significantly improved gut motility, reduced intestinal inflammation, and led to measurable shifts in the gut microbiome within just 2 weeks. When your stomach empties by 10 or 11 at night, your migrating motor complex has 6 to 8 uninterrupted hours to sweep your intestines clean before you wake up. That is the difference between a gut that is managing and a gut that is genuinely restoring itself. Now let's talk about the foods that directly support this process because what you eat in the hours before that early dinner matters enormously. Flax seeds are one of the most clinically supported natural gut cleansing agents that exist. They contain a specific type of soluble fiber called mucilage, which forms a thick, gel-like coating when it contacts water in your digestive tract. That gel acts like a gentle sweeping agent, lubricating the intestinal walls and carrying waste materials smoothly toward the exit. A randomized controlled trial published in the Journal of Nutrition found that 4 grams of ground flaxseed per day, consumed consistently, improved bowel transit time in older adults by nearly 30% and significantly reduced markers of intestinal inflammation. 1 tablespoon of ground flaxseed stirred into a small glass of warm water and consumed in the early evening gives your gut the lubrication it needs to complete its nightly sweep efficiently. Always use ground, not whole. Whole flax seeds pass through largely undigested and deliver almost none of the benefit. Kiwi fruit is a food that surprises many of my patients when I recommend it, but the evidence behind it is genuinely compelling. A double-blind clinical trial published in the American Journal of Gastroenterology tested the effects of 2 kiwi fruits per day on adults with chronic constipation. Within 4 weeks, participants experienced a 45% improvement in bowel frequency and a significant reduction in straining and discomfort. The mechanism involves a unique enzyme called actinidin, which accelerates the breakdown of proteins in the digestive tract and speeds gastric emptying. 2 kiwis eaten in the late afternoon, a few hours before your early dinner, give your gut a meaningful head start on the evening cleanse. Warm water deserves far more credit than it typically receives in conversations about gut health. When you drink cold water, especially first thing in the morning, your intestinal smooth muscle responds by tightening. Blood flow to the gut wall temporarily decreases, and peristalsis, the rhythmic contractions that move contents forward, slows down. Warm water at around 104 to 110 degrees. Fahrenheit does the opposite. It relaxes the smooth muscle of the intestinal wall, increases blood flow, and triggers a gentle but real wave of peristaltic movement within 20 to 30 minutes of drinking it. A glass of warm water is the very first thing you consume each morning. before coffee, before food, before anything else, is one of the simplest and most effective ways to signal to your gut that it is time to finish what the night's cleaning cycle started. Yogurt containing live active cultures deserves special attention here, specifically for what it does to the gut environment overnight. The beneficial bacteria in quality. Probiotic yogurt, particularly Lactobacillus acidophilus and Bifidobacterium longum, compete directly against the harmful bacteria that produce the inflammatory compounds linked to gut permeability and systemic inflammation. A meta-analysis published in The Lancet in 2022 reviewed 43 clinical trials and concluded that daily probiotic consumption in adults over 60 led to significant reductions in intestinal transit time, bloating, and markers of intestinal inflammation. A small serving of plain, unsweetened yogurt with live cultures, consumed about an hour before your early dinner, helps populate your gut with the microbial allies it needs to function cleanly through the night. Now let's address something almost no one talks about, and yet it may be the most immediately actionable piece of information in this entire video. The position of your body on the toilet directly affects whether your colon can empty completely or not. The puborectalis muscle wraps around your rectum and maintains a kink in the lower colon that prevents involuntary release when you are standing or sitting upright. This is an essential design feature, but when you sit on a standard Western toilet with your hips at 90 degrees, that kink does not fully release. Your colon is trying to empty through a partially closed angle. A study published in the Journal of Medical Hypotheses using radiopaque markers to track stool movement found that squatting, or simulating a squat by elevating the feet on a footstool, to raise the knees above hip level, reduced average bowel emptying time by more than half and significantly decreased the straining required. A simple footstool 7 to 9 inches tall placed in front of your toilet changes the angle just enough that your colon can empty far more completely with each visit. Many of my patients who started using one told me they felt noticeably less bloated within the first few days. So let me bring all of this together into a protocol you can actually follow starting tonight. This is not a complicated regimen. It is a precise sequence built around the biology of how your gut actually cleans itself. In the late afternoon, eat 2 ripe kiwi fruits as a snack. At or before 6:30 in the evening, sit down for your last meal of the day. Keep it light and plant forward. Steamed vegetables, a modest portion of fish or legumes, and a small serving of plain probiotic yogurt. No bread, no sugar, nothing heavy or fried. Your goal is a stomach that empties by 10 or 11 at night. About 30 minutes before or after dinner, stir 1 tablespoon of ground flaxseed into a glass of warm water and drink it slowly. For the rest of the evening, drink only warm herbal tea. Chamomile and peppermint are excellent choices, or plain warm water. No snacking, not even something small. Remember, the janitor cannot work if anyone is still in the building. When you go to sleep, try lying on your left side if you can. The anatomy of your colon means that the descending section, the final portion before the rectum, runs along the left side of your body. Lying on your left side uses gravity to assist the natural downward movement of waste toward the exit while you sleep. In the morning, before anything else, drink 1 full glass of warm water. Then give yourself 20 to 30 minutes before eating breakfast. During that window, you may want to try a simple movement that many of my patients find remarkably effective. Lie flat on your back, draw both knees gently toward your chest, hold for 20 to 30 seconds, release and repeat 4 or 5 times. This applies mild rhythmic pressure to the ascending and transverse sections of your colon and can encourage that final morning movement that represents your gut, completing the night's work. Use your footstool on the toilet. Be patient. Do not strain. If things do not move in the first hour, they often come in the second. Your gut is relearning a rhythm that has been disrupted, and one morning is the beginning, not the whole story. Now, a word of honesty. If you have an inflammatory bowel condition, such as Crohn's disease or ulcerative colitis, or if you are on blood thinners or immunosuppressants, please speak with your doctor before making changes to your fiber intake or eating schedule. The protocol I have described is gentle and food-based, but your individual circumstances always matter most. For everyone else, here is what the research and my clinical experience consistently show. Within 3 to 7 days of following this kind of structured evening and morning routine, most people notice their morning heaviness lifting. Bloating decreases, bowel movements become more regular and more complete, and many people describe a mental clarity in the morning a sharpness they had not felt in years, that they did not expect from changing the timing of their dinner and adding a spoonful of ground flaxseed. That clarity is not a coincidence. When your gut is completing its nightly cleaning cycle properly, the bacterial population in your intestines shifts. Less waste-producing, inflammation-driving bacteria. More of the kinds that produce short-chain fatty acids, compounds that directly feed the cells lining your colon, reduce gut permeability, and send anti-inflammatory signals through the gut-brain axis to your nervous system. You feel it in your stomach, but it registers in your brain. Aging does not have to mean an increasingly sluggish, uncomfortable gut. It means your gut needs smarter support, the right timing, the right foods, and the right conditions to do what it was designed to do. Give it those things, and it will respond. If this gave you something real today, share it with someone you care about who wakes up feeling heavy every morning and has accepted that as normal. It is not normal, it is a signal. And now they know what to do about it. I am Dr. James Harlow. Take care of your gut tonight and let it take care of you.